Imerys is absolutely committed to the health and wellbeing of its employees, as well as safety and environmental are clearly important to us in the industry we work in, and branching out to health and wellbeing is the natural progression from that.
Mental health is therefore becoming an important topic of general health. It impacts our sleeping habits, it impacts our eating habits, it impacts our physical conditions. We should make it easier to discuss this topic between colleagues without creating a fear of reputation, of losing one's job because of this.
So as a result of the uptake in mental health referrals in 2019, we started to educate and communicate around mental health. The decision was made that we needed to educate people to prevent them being referred, so addressing the problem at root. We did various initiatives on mental health specifically. We went through training. We trained an initial cohort back in 2019. I think it was around about 20 people at the time as mental health first aiders. The reason to train mental health first aiders was to raise awareness on the topic, and we felt it's important to get colleagues trained and not just the HR department, for example, in the hope that it would help break down barriers and people feel more comfortable talking to the colleague in a canteen as opposed to coming into HR to talk about it. So anybody can volunteer to be a mental health first aider. Currently we have over 50 and they range from operatives and quarries and finers right up to senior management both in the UK and abroad in Europe. Our mental health first aiders are there as a point of contact for any employees that want to talk, and the idea is that they'll be able to signpost that individual to the support they may need.
Well, hopefully within Imerys we can start breaking down the stigma. I think the stigma stems from people not having the awareness maybe of mental health illnesses because they don't look the same as physical illnesses or the things that have physical symptoms.
Mental health risks are less visible and quite often their impacts, their consequences are also less visible. And therefore, we as managers, as leaders, we must remain extremely vigilant.
Mental health first aiders can provide additional support and signpost towards our extensive employee assistance programme.
We broadened out to focus not just on mental health but general well-being as well. So we produced leaflets on musculoskeletal management, for want of better words, heart conditions and how to prevent them or try to prevent them, as well as around stress management. We've also put in place financial education because that can be quite a stressor for people, more so in today's climate than probably when we launched it several years ago. And all that is being refreshed and reminded as often as we can. We also have an employee assistance programme, which is an anonymous support line they can call.
People have used our EAP system. They have made contact with the companies that we have links to, so that they've been able to discuss their issues further, seek the advice that they've needed, and I have known colleagues to be grateful for that assistance in pointing them in the right direction.
The benefit of educating people means that we're more proactive at identifying potential issues with mental health and therefore getting employees the support maybe quicker than they may have done in the past.
It's not the taboo subject it once was or could be, especially in the mining environment, which can be male dominated. And I think we've taken from that and we've learned and we've brought that to a group level. And again, we recognise that there's discussions that are required between human resources, health and safety, and there's a lot of good work that's coming as a result of that. And it's good to see that this will be pushed out into other regions and geographies as well.
Ultimately, the aim is to create an open environment where employees feel comfortable talking about all sorts of issues, not just mental health, but all sorts of issues. It links to our diversity and inclusion principles. If someone feels more included, they're less likely to have mental health issues. And that's what we're hoping we can achieve by this in the medium to long term.